Welcome to JAT Chat, the official podcast from the Journal of Athletic Training, brought to you by the National Athletic Trainers Association. I'm Dr. Kara Radzak from the University of Nevada, Las Vegas, and today it is my pleasure to be joined by the two co-editors for the special issue on pediatric anterior cruciate ligament injuries. Dr. Sandra Shultz is a professor at the University of North Carolina, Greensboro, and I'm also joined today by Dr. Brian Pietrosimone, professor at UNC Chapel Hill. Thank you guys so much for joining me today.
Thanks for having us.
So first of all, Sandy and Brian, the first question is why focus on pediatric, right? You could do a special issue just on ACL injury. Why focus on pediatrics?
Well, I think we've done quite a bit on just ACL injury. And I think many of us in the university setting, we often study a convenient sample of college athletes. And when you really look at the injury incidence, ACL injury risk really begins to rise about 12 years of age and accelerate up until it peaks around 16, 17 years of age. And that's a time frame where pediatric ACL injuries are really outpacing those of adults. They're getting injured at younger ages. But when you look at the research, only about 15%, if you do a PubMed search, only about 15% of articles on ACL risk and prevention are in the pediatric athlete. So if we're going to get ahead of the injury, we really need to start focusing on what's really the most vulnerable population. So that was really the impetus of really wanting to focus on this younger population for the ACL retreat and the special issue.
Yeah, I think, like Sandy was saying, trying to raise awareness for the need to do more research in this area was really a big thing for us. We scoured a lot of the different research groups, looking for, really good papers, to get into this special issue and to, be at the ACL research retreat. And, it wasn't easy, not because people weren't, doing great research out there, but just like Sandy said, a lot of times this group of people, even though they're, sustaining a lot of the injuries, we weed them out of our studies. Mm-hmm. So, this was really kind of a, call to action a little bit to really start to, research this really important subgroup.
And Brian, how has ACL injury treatment changed over the past few years in regards to pediatric populations?
Well, that was kind of the thing that, made us a little nervous after seeing, a bit of the research in this area was that, ACL, I guess, rehabilitation and treatment, right, is definitely evolving, across the board. And we're doing a lot of, I guess, innovative and different things, but, in the pediatric population themselves, it's not really changing any differently, right? Or substantially compared to adults. And like Sandy says, oftentimes we're treating them like, just little adults, right? So, that was something that came out of, I think a lot of the work and the discussion that happened at the ACL retreat and the work that was, in this special issue, that there are differences that are emerging, pre-injury, after injury, that should be treated potentially differently than the adult ACL population.
So what are some things that we can expect, that readers can expect out of this special issue? What are the types of publications?
Well, one, we've got a couple of articles that is really evaluating primary risk and prevention. One is a large systematic review of how risk factors change during age and maturity level. And it really speaks to the need for future longitudinal studies, because what we learned is there's a lot of gaps in that information. And it was a process, but I think it really shows as much what we know and what we still don't know and what is still needed. Other papers are looking at advancing our understanding the role of central processes. We've looked a lot at neuromuscular control and things around the knee, but this is really looking at more of how the brain interacts and plays a role in injury risk and prevention. Other basic science orthopedic studies describing recent trends in ACL maturation, reconstruction, operative techniques, and finally, several papers that focus on rehabilitation strategies, return to play criteria, particularly focused on the pediatric population. So we take it from really soups to nuts in terms of initial risk and prevention to secondary risk to, how we need to structure our rehabilitation to avoid that secondary risk and long-term complications, because these young pediatric athletes are also going to develop osteoarthritis sooner and are more likely to suffer secondary injuries. So how we treat them after that initial injury is pretty critical.
Yeah, you're really spanning the whole range. And what are some key takeaways that you're hoping clinicians are going to be able to get out of this?
I think some of the key takeaways, right, are that this is a different population, right? This is a different population of people, right? And I think, obviously, it's known, but when you look at some of the, the results that came out of that systematic review, and you see the changes in, pediatric patients, right, really early on, there are, dramatic sex differences as well. All right. Mm-hmm. So that this might actually end up getting, further into the weeds, where we have to understand not only these differences in maturation, right, that could affect risk and, rehabilitation, but also, the differences between the males and females, at some of these different maturation levels.
And I hope that it takes us a little bit earlier too. Like when you look at most of the ACL prevention programs that have been looked at, they've either been in college or even the adolescents are more mature adolescents. So, I think the youngest is like 14 years of age, and most of them is later. But we know that these sex differences develop as early as 8 to 10 years of age. Mm-hmm. So, hopefully this will help us think even young, like what's happening before that 14 years of age when that risk is really beginning to peak. But that requires, us doing some longitudinal work and really understanding those developing athletes and how males and females develop differently, as well as both at the, not just between sex, but at the individual level. Not everybody develops risk. So, what are those developmental processes?
And I think also some of the other interesting aspects, in addition to some of the physical impairments, right, that we see in the pediatric population, there was a lot of work also done with some of the mental health, studies and changes. And there were some interesting studies looking at communication between the clinician, the patient, and in this case, right, like the parents, so there are a lot of, other, interesting things to navigate for, I think, the clinician when they're, working with this population. That are some interesting papers within this special issue.
Yeah, you guys are spending that whole time frame, but also all the different aspects. I really do like we're seeing more in all areas of research of actually taking into consideration the mental health of the patient and that interaction, that patient-clinician interaction. So that's something that I'm looking forward to seeing out of this special issue. So what are some things, kind of broached into that already? What are some things that you're really excited about with moving this research into the future? Some gaps that were identified, some potential areas of growth or need?
Yeah, this kind of goes to the call to action a little bit that we put in the editorial at the beginning of the special issue. But, one of the things just, that we saw a bit was that many of the studies that were done were not necessarily created to, specifically evaluate pediatrics. Sometimes this was, a side project that was part of a cohort that people, put into the, the special issue. And and what we really need is probably to develop and design studies specifically to look at this subgroup. And, we realize, there's a lot of reasons why this is difficult, the consenting process in this group, of individuals. Right. And, so that's an immediate hurdle to doing this research. And, I think trying to get some of the youngest individuals, right? A lot of the studies, even looking at pediatrics, are skewed to the older group.
Right.
And I think one of the things that, the systematic review and meta-analysis that Sandy was describing and led was that we realized that age really is probably not the best way to characterize, right? This subgroup, we really have to look at skeletal or sexual maturity really to have a better control. So there's a lot of factors that make it difficult to research in this area, but there's a dramatic need to do it.
Yeah. Yeah. I think with getting away from age, just an example, males and females go through these maturation stages at different time and at different speeds. You could have on average, maybe a female hits menarche at 12 years of age, but it can happen anywhere between 8 and 15. And so using, and also I think another thing we learned across the studies is how maturation is categorized. It's not consistent. And so part of it is, can we use common categorization so that we can compare some data across studies. I think another thing is, this research, we're going to have to get out of the lab to find the pediatric patients. And so another thing that I think a few of the papers addressed were barriers. What are some of the barriers to either implementation, making it accessible, especially when it comes to prevention? What are coaches' perception in terms of making this a part of sport and not an add-on? What level of stimulus do we need to really affect a pediatric versus adult? So we're really hoping that we need to communicate, or we need to think about, outside the lab, how can we create collaborations that allows us to do this work in the community and on a larger scale, so that we can really understand and impact this population.
So if you were to look into the future, what is your hope? How long will it go before we have another special issue on this? And what are some things that you hope to see changed?
We were hoping that maybe in a decade we would have another special issue on this, and we wrote a few ideas down, I think, in the editorial about what we would hope to see in that what was it, 2033 special issue.
So far away.
On pediatric ACL. And, I think one of the main things was to decrease, to understand what are the primary risk factors in the pediatric patients to decrease ACL injury risk, to understand, what specific evidence-based treatments would, get pediatric patients back to activity and decrease, that long-term, deleterious change in their joint tissue health. So, I think those were the main things that we need, really focusing on, that patient population.
And we'd love to see that percentage of literature go from 15% up quite a bit higher, that it's more representative in the scientific literature, that we just have more knowledge and evidence to share with clinicians.
Mm-hmm. Now, in addition to our listeners being primarily clinicians, there's probably a lot of parents out there, right? And so what would be some things that were found, or if somebody listening is a parent who might have a child who's in this high risk population, some give them some hope?
I think part of that is on us to make sure that we are providing this information to be accessible to parents and coaches, that we are a resource to them for implementation. I think they do seek us out to, you'll get calls. My daughter just tore her ACL and she just started her period, within the last year. Is this something to do? You're answering these type of questions, but they are looking for people know what an ACL is, I think, and so providing this information and digestible and where they can go to get for screening, where they can go for prevention strategies, but it certainly needs to become more of a mainstream community engagement, with what we're doing. Again, taking this out of the lab and into the community, and I think that's where I think we can really have the biggest impact is moving towards more community engaged scholarship with some of this.
Yeah, and I think when it comes to parents and clinicians, to go back to some of those, studies that were looking at the communication in this group, I think, one of the things that was really important was having good communication between the parents, the patient, the clinician, right? The rehabilitation clinician and the surgeons. And also, the idea that, consistent support was really critical for, these patients, these pediatric patients going through ACL rehabilitation. I think the other thing to think about is, like Sandy and I were saying, the call is to have more research in this area. Parents, patients need to be keeping up with new research that's out there and advocating for, the newest prevention strategies and the best rehabilitation. So keep your eye on the news, the PubMed, to see what's actually coming out.
And that's part of us partnering with them. I think sometimes we have this idea what we want to research, but sometimes we need to find out what their needs are, what their perceived needs are. Trying to work with a group, just as an example, was trying to work with a group on prevention. And it's like, well, all they need to do is stretch and drink water. There's a big educational component to that. But what do they perceive the need to be? And, what do coaches need to make this something that's doable to implement versus, hey, we want to do this intervention. So the more that I think we can partner with parents and with coaches, the more buy-in. And I think the more effective the impact and effective and impactful that research could be.
So any last things that you want to impart on the audience of why should they go out and seek the special issue?
I think there's something for everyone from the standpoint of if you're interested in injury risk, avoid, what are some things that we need to be thinking about and looking for? New aspects of thinking about injury prevention, those who are actively in rehabilitating, some people it's what are the current advances in how these are being surgically repaired, and how is that going to affect the way that I think about rehabilitation or as well, and care for that athlete. So I think there's wherever you are on the spectrum of seeing athletes with ACL injury, whether it's before or after, I think there's something in there for you.
So again, thank you guys so much. And all of the researchers out there, start working now for the 2032 call for the next special issue. I greatly appreciate you guys taking your time to talk with me today. Dr. Shultz, Dr. Pietrosimone, thank you again. And this special issue of pediatric ACL injuries, like all of JAT's material, is available open access, free of charge. Thank you again.
Thank you.
Thank you.